Hello, everybody. This is going to be a video on phase angle in cancer. This is Dr. Kevin Connors, and to help people understand what the phase angle is. The phase angle is measured when you come in our office. Other clinics measure phase angle. Cancer Treatment Centers of America, I believe, measures phase angle. Typically, oncologists don't, and I don't know for what reason. But we're going to look at what phase angle is. Most of the studies on phase angle are with cancer patients. And we want to see how we're going to look at that. So what is a phase angle? A phase angle is a ratio between what's called the reactance and the resistance when you test a person with a bioimpedance analysis test. So a bioimpedance analysis is a specific instrument that where you hook up little electrodes to the hand and little electrodes to the feet to the same side. And then the machine puts a little teeny electrical impulse in, and it measures the resistance across the cell membranes as that electrical impulse travels through the course of the body. So it's that resistance across the cell membrane that's put into a calculation, the mathematical calculation that tells us what's called the phase angle, and it's really measuring the cell membrane integrity. So your cell membrane, if you remember from biology class, is a phospholipid bilayer. So it's two layers of this phospholipid, long lipid chain with a phosphorus group. And what that phospholipid bilayer has a hydrophilic and hydrophobic side. And not going to get into cell biology here too deeply, but that cell membrane is really the health of the cell. Some people call it actually the brain of the cell. There's thousands of receptors embedded in it, calcium mineral channels embedded in it, different channels where nutrients get in the cell and exit the cell. The receptors are where different proteins and enzymes attach to that receptor on the cell membrane that are specific for that specific nutrient or hormone or protein or enzyme, and that turns on different things, kind of like a lock and key mechanism that turns on different processes in the cell. Very important for cancer patients because many of those processes are apoptotic processes, how a cell will go through normal cell death. It turns on a caspase process that will turn on a cell death process within the cell. Very important, the health of the cell membrane. We could say the health of a person's cell membrane is literally equated to the health of the person. So your cell membrane and your cytoplasm, the gelatinous water inside the cell, is really what we're trying to affect when we're trying to increase the person's cell health and increase their overall health. So that's what we're looking at with a person. What is a normal phase angle? So a phase angle is read from 0 to about 11.5. If you were at a 0, you'd be dead for a couple days. You have a cell charge, a phase angle. Think of it as your cell charge, the cell membrane charge, the cytoplasm charge. And you even have a phase angle after you pass away. It takes a few days for that phase angle to go down to 0. But in a healthy person, your phase angle would range anywhere between 5.0 to 10. Now, we have had, I don't remember anybody measuring, higher than 10 point something. But the younger the person is, the higher the phase angle will be because they haven't been exposed to many toxins, many poisons, many things that damage our cell membranes, and you're going to have a higher phase angle reading. So an adult, normal adult with no disease process, fairly healthy, in their 20s is going to have a phase angle usually between 7 and 9. There was a time where I treated a number of the Minnesota Vikings players, and their phase angles were in the high 7s, 8s, up to low 9s. But just because they're wonderful athletes doesn't necessarily mean they eat well, and their cell health is really that great. As we get sick, as disease processes take place, somebody with cancer can have a phase angle between 5 and 6.5. I typically tell patients I want to see their phase angle at 5.5 or higher. That would be more advantageous for the patient. Their ability to heal would be better. We've had patients where their phase angle is in the twos. That's a very, very ill person. Chance of recovery it's much more grim, it's more difficult, because again, the phase angle is the charge of the cell, the health of the cell membrane, the health of that cell cytoplasm, how well it carries a charge, and that is all important. So we want to raise that person's phase angle, but how does the phase angle get bad? What does it tell us? So most research on phase angle is done on cancer patients. And the lower the phase angle suggests a deterioration or a loss of healthy charge of that cell membrane again. In advanced cancer patients, it may result in reduced overall survival rates. Again, most of the studies on phase angle are done with cancer patients and are measured as the cancer patient goes through treatment. And usually that treatment with the studies is standards of care. So the person is going through chemotherapy or radiation, and most of the studies show is if the person's phase angle plummets during their treatment phase, the overall survival also plummets, meaning the chance of that person surviving their care goes down dramatically. If we could keep the person's phase angle level, if it was in a pretty safe category, if it was above 5.0, if we could keep it at that, the chance of the overall survival is greater. If we could get the phase angle to rise, that's even better news for the patient. If the phase angle is going down, especially dramatically, that's not as good. Now understand, phase angle is not going to shift all that rapidly. So if a person comes in, we test their phase angle, let's say it's at 5.5, put them on a clean diet, clean them out, detoxify them. They're using the Rife machine. They're using some other instrumentation, and we measure it again in a month. It might not shift at all. It still could be 5.5. Let's say they do everything right. In 3 months, it could be 5.7. So there's not going to be these drastic changes in phase angle. We've seen some drastic changes, but overall, you're typically not going to see that. Where you can see drastic changes is if a person is doing chemotherapy, they could drop from a 5.5 to a 4.3. That's typically not a good sign. So even if they're doing everything right, if their cell charge is being lost because of being poisoned by different things, and that's not a good sign. And that's really where the studies have shown with cancer patients and phase angle. So how do you improve your phase angle? How do I change this? How do I improve it if I have to do chemotherapy? If I'm not doing chemotherapy and I'm starting with a phase angle of 5.5 or 4.5 or even worse than that, what do I do? So detoxification is important because, again, that cell membrane is that phospholipid bilayer. That is the problem with bad fats like trans fats. They actually superimpose over and into the phospholipid bilayer and actually cause kind of a plasticized cell membrane. So the receptors are displaced and not usable, and the channels where nutrients get inside the cell are not usable, and it basically kind of smothers the cell. That's why bad fats are bad for us, and they can kill us because they, over time, displace phospholipid uh, uh, bilayer cells and then take that place inside the cell membrane and damage the cell, and the cell can die. And you do that to a number of cells, and we're in trouble. So we want to detoxify. Heavy metals, large chemicals damage that cell membrane, can embed itself in those cell membranes. So we want to detoxify. So we talk about detoxifying. This is not a lecture on detoxification, but we've got to go backwards from what we could call phase 3.5, getting stuff out of the colon and the kidneys, to 3, getting it out of the liver and out through the bile duct, to 2.5, getting it conjugated in the liver so we can get it out of the bile duct, to phase 2, where you're conjugating it and changing it into water-soluble particles. These are toxins we're talking about in the liver. and to all the way backwards to phase 1 or phase 0, getting it out of the cell membrane into the blood, to get it into the liver, to get it into the bile duct, to get it into the colon, to get it into the toilet. So these levels of detoxification, we want to go backwards and up to that, pulling it out of the cell, pulling it out of the cell membrane, getting it into the blood to get it out of the body. So detoxification is huge and key. If you want to improve your health, you have to detoxify. Bottom line, you are what you don't detoxify. So that's the key. So if you can't get it out of your body, it's going to become a part of your cell, either inside the cytoplasm of the cell or inside the cell membrane. It's going to drop your phase angle. Your charge isn't going to be there, and you're going to die an early death. That's what causes cancer, and that's what we're trying to prevent. When you're dealing with a cancer patient, that's what you're trying to prevent before you have cancer. So detoxification is key. That's important, number one. Improving overall health ties into that. So you're changing your diet, you're changing your overall health, changing your thought process, everything you possibly can do to exercise to take care of yourself. Improving overall health is going to help your cell, your phase angle, and your cell membrane health. Adding good fats, phosphatidylcholine, and parent essential oils is key. Now this, we use a parent essential oil from PHP and Body Bio PC, which is by far the best phosphatidylcholine on the market. Those are good fats that you can take, but just doing those alone without doing these other things is going to not be a good thing. Rife is key, so Rife technology, using light frequencies to help add charge to the cell membrane and bring charge back to the cell and the cytoplasm, is absolutely key in my book. And I have lots of videos on Rife technology and why that's important. And that's a big piece. You talk about, oh, Rife is going to kill the cancer cells. Well, yes, that is taking place, but if it's doing nothing but bringing electrical integrity back to the cell membrane and the cytoplasm of the cell, you have improved that person's life tremendously, and you're going to help be able to take a cancer cell and turn it into a normal cell again, meaning that it's not going to replicate anymore. And that's the key to Rife technology. Adding PEMF, pulsed electromagnetic frequency machine, can be very helpful too. Either low or high frequency machines, I believe, both help and aid in cell membrane and cytoplasm potential. So those are key components to help with that as well. All right, hopefully this helped you understand a little bit about phase angle. The questions that I've had with this, well, where do I get my phase angle checked? There's certain instrumentation that's better than other. We use the RJL instrumentation, which according to the Navy, who did a number of studies on this, the US Navy, they said that that is the best instrumentation. That's the instrumentation they've used. That's why I picked that instrumentation. You go to a clinic, typically it's going to be a cancer clinic that's going to have phase angle testing equipment. Again, I said, I'm pretty sure my patients have said Cancer Treatments of America, those centers have them. We've used it for over a decade. It's been great instrumentation to be able to say how well a person is doing. And again, the negative of it is you're not going to change that phase angle quickly. So you're not going to like, I'm going to change my diet and change everything and add a Rife and PEMF, and my phase angle is going to go from 5.5 to 7.0 in a month. It just doesn't do it that way. It takes time to change your cells, and you have to be patient and start doing the right thing. That's why we often say that it took 20 years for you to get cancer. Maybe the cancer wasn't growing in you 20 years, sometimes it is, but the ill health took place over 20 years. The choices of life, the exposures to toxins, the mercury toxicity, the whatever it was that brought your total cell health down is what caused the ill health in the first place, and it's going to take time to get better. So be patient with yourself, start doing the right things, start adding these things. A lot of our patients are from a distance, so they don't get back to get their phase angle rechecked. Is it important? No, it's not important. You just continue to do the right things. You just keep doing the right thing. You don't necessarily need to measure it again because you just keep doing the right thing. So I know we live in an analytical world and everybody wants to know, but we can't always do that. But so our local patients have the ability to get their phase angle checked, and we do that on a regular basis. Hopefully it was helpful. This is Dr. Kevin Connors. You can contact me at the left-hand corner, Connors Clinic, and we will talk soon. Thanks.